NADA protocol for behavioral health, putting tools in the hands of behavioral health providers, the case for auricular detoxification specialists. This is from the National Library of Medicine, National Institute of Health. Introduction. The National Acupuncture Detoxification Association, NADA protocol, also known as AcuDetox, originally designed for use in acute heroin withdrawal, has become a remarkably effective tool applied to many populations receiving behavioral health care and primary health care. Not a replacement for other modalities, the NADA protocol is always understood to be best utilized in an integrated setting with the right match of biopsychosocial spiritual supports and interventions. Nor is the NADA protocol a replacement for Chinese medical care, which excels at diagnosis and individualized treatment, including a broader range of auricular interventions. Integrated behavioral health care is where behavioral health and medical providers work together to address the emotional, mental, and spiritual side of any medical condition in order to improve outcomes. The factors we call stress or stressors contribute to worse outcomes in health care, whether in primary care or in illnesses more traditionally understood as behavioral health disorders, mental illness, stress, grief and loss, addiction, trauma, and disaster responses. The NADA protocol is a tool that can be broadly, efficiently applied by behavioral health professionals in a myriad of settings. What prevents or limits that happening has to do with access and availability of trained healthcare providers who can incorporate the protocol into existing systems with existing staff rather than relying on outside acupuncturists or medical acupuncturists. The ability of trained healthcare specialists to practice the protocol as auricular detoxification specialists, ADS, depends upon legislation, regulation, and scope definition. This paper makes the case for ADS provision of AcuDetox, reviewing the historical background and development of the NADA protocol and related legislation, exploring how legislation affects application and availability, and offering examples of how the NADA protocol can flourish when appropriate measures allow that growth. Oh, well, I fucked up because I just did a lot of reading and I don't know.